Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Dalhousie.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi, everyone. Welcome to another episode of the Egg Whisperer Show. I'm so excited to have a special guest from Canada, Meghan Rossi. She is a Ph.D. student, and she's going to talk to us about her very special study that I'm hoping you can help her with. The title of today's show is Project Journey, a study investigating how couples navigate fertility treatment. Hi, Meghan.
Hi, Amy. Thank you so much for having me.
Thank you for being here. Thank you for your work. Tell us about yourself.
Yes, so I am a PhD student. I work at Dalhousie University in Halifax, Nova Scotia. And basically, I am a clinical psychology student. And so, in a few years, I will be a clinical psychologist. And my research areas include how couples navigate pain during sex, as well as fertility challenges, and also throughout the transition to parenthood. So I have kind of scoping areas of research, but essentially how couples adjust to sexual and relational challenges during pretty stressful life events.
Yeah. And then what made you interested in this research topic?
Well, specifically to kind of fertility treatments and such.
Yeah.
So while I think that essentially what we know is that we don't know a lot about how couples navigate some of the declines to their romantic and sexual well-being throughout the fertility treatment process. And I think that this is just an understudied population who are really in great need of supports and resources for navigating some of these difficulties that they have. And so I'm pretty passionate about helping couples get through some of these challenges.
Yeah. I mean, my families that I'm helping, they're super busy. They're still trying to, fit in clinic visits. So what would be involved in your study? Tell our audience.
Yes. So absolutely. This is a very stressful time for a lot of couples, and we don't want to, add any more to that. So our study is actually over a 2-year period where couples complete online surveys every 6 months. So it's not overly burdensome by any means. The online surveys that they receive just take about an hour to complete every 6 months. So a total of 5 surveys across this 2-year period.
Yeah. And then who can participate? Who can be involved in your study?
We are looking for couples across Canada and the US who have recently made one of their first visits to a fertility clinic within the last 6 months. And if they have had fertility treatments in the past and have since returned to a clinic, they would also be eligible to participate in this study.
And how old would you have to be?
18 years of age or older.
Yeah. And is it, same-sex couples can participate, heterosexual couples? Can you tell me, is it gender inclusive?
Yes, absolutely. And so we are anyone, all bodies, all orientations, all gender identities are eligible to participate in the study.
Okay. And then what will people get? I mean, aside from feeling they're contributing to science, is there some sort of incentive for people to sign up?
Yeah, so we know that, completing surveys over a 2-year period can be a lot, and we want to thank couples for their contribution. So for every survey that couples complete, each of them will receive an Amazon gift card. So for Canadian couples, they would receive up to $180 in Amazon gift cards for participation. In US, the conversion rate does change a bit. So I think it's about $140 for couples. But yeah, they would receive a gift card after each survey that we complete. And
maybe we should also throw in a pair of my Egg Whisperer pants. For those of you who don't know what that is, go to eggwhispererpants.com. Okay, keep going.
I love that. That sounds great. Yeah, so in addition to the gift card that they would receive after each survey, couples who complete all of the questionnaires at all of the time points would also receive, or rather be entered into a draw to win one of 5 $100 Canadian Amazon gift cards.
So if someone wants to sign up, where do they go?
Yes, so you can access our website. That's natalieorosen.com. or you can contact us at journey.project@outlook.com.
So journey.project@outlook.com. That's easy enough. So they'll just email that email, and then they'll start getting onboarded with your study, and they can start working on the questionnaires. So does each partner get a separate questionnaire to fill out, or is it just one for the couple?
Great question. Yes. So each member of the couple does get sent their own separate survey to complete, and they do it all online. They click on a link and they get right to the survey.
Okay. Well, let's just talk a little bit about stress and trying to get pregnant. What kinds of things do you find are the most stressful among couples who are trying to get pregnant?
Mm-hmm. Well, speaking from kind of my research field, knowing the relational and sexual challenges that often arise. So we know that as couples navigate treatment, there's a lot of pressure to perform, right? Couples have to have sex around kind of peak ovulation times. And there is kind of a motivation for sex for kind of procreation rather than desire or pleasure. And so all of those aspects can trigger a lot of stress and a lot of pressure to be having sex in a particular way at a particular time. And that can really impinge upon couples' sexual functioning and their well-being, their desire for sex, the pleasure that they have, and all sorts of other facets of their well-being.
Do you happen to have any tips for people who are dealing with that, stressful sex?
Yeah. So, well, we know that when they are navigating these stressful sexual experiences, really opening up that line of communication about those challenges is one of the biggest ways that couples can better navigate these difficulties. Because if you're not communicating to your partner that these challenges are coming up for you, that partner might not know how to address those concerns that you're having. And when you can open up that line of communication for each other in an open, compassionate, validating way, each member might feel better supported and more able to navigate what those challenges are and troubleshoot them and figure out ways to kind of boost that desire again for their sex lives.
Yeah, that's a great tip. And what about relationship issues? I know the key is communication, but what types of suggestions do you have for a couple who's dealing with stress, not just in bed, but in general surrounding conception?
Yeah, so speaking from what I know about the literature, we don't know a lot about how couples can really capitalize on their relationship challenges specifically. We know that for certain couples, it's how they perceive the challenges and what they think about the challenges to their relationship often then impact their behavior and their emotions. So for example, a lot of couples, a very common thought that individuals have when navigating fertility challenges is blame, is feeling that, they're the ones responsible for these challenges and a lot of guilt around that. And having that feeling can be really painful and really one way of kind of coping with some of those underlying emotions that often come through, right? That anger, that sadness, a lot of hopelessness. So those kinds of reactions can be really hard for couples to navigate together, and that can contribute to stresses in the relationship. If you're feeling that you're the one to blame and you're feeling insecure about your partner potentially, leaving you or having those concerns about the stability of your relationship. On the flip side, if you have blame for your partner, knowing that maybe they are the ones that have maybe the infertility diagnosis, and how do you manage those really difficult feelings when you love your partner and you want to support them? And so what we know from kind of the broad couples and sex therapy literature is that, when you can openly express those emotions and tell your partner that you're feeling that way, either with the help of a therapist to process those emotions, that and having your partner respond in a validating and responsive manner, this can help you both feel more supported in this journey. Because, right, if you're both not on the same page about these feelings of blame, that can cause that resentment, that instability and insecurity in your relationship. And so having that communication and validating those emotions is really important.
Right. So it's important to nurture that relationship throughout the whole process. I totally agree.
Yeah.
So tell us again the title of your study.
It's Project Journey, really investigating the factors that promote couples adjustment throughout fertility treatment.
And then again, where can they find information about the study and how to sign up?
Yes, so it's nathalieorosen.com that they can go to for the English-based version. Then if they, sorry, just one moment, I want to make sure I'm giving you all the right information.
No problem. And I'll post it on my website as well.
Excellent. Thank you so much. Really appreciate this.
Of course.
So you can email us at journey.project@outlook.com.
Awesome. Well, I wish you all the best, Meghan. I can tell that we're so lucky that you're in this field. What's next for you after you have your PhD? What can we expect? What amazing things can we expect from you?
Oh, thank you. Yes, that's a pretty exciting and exciting thing to be considering. I definitely want to, engage in clinical work, working with couples who are experiencing relational and sexual challenges, either fertility related or pain related or just sexual dysfunction in general. But I'm also very passionate about research. And so hopefully I can find myself some kind of academic job or a research-based position where I can continue to explore how to improve couples' sex lives.
Absolutely. Well, that's really, really important. Well, thank you, Meghan, for spending time with us today. Thank you, everyone, for joining this show. And I hope, if you feel like this study is for you, that you will sign up and help Meghan with her research project, because it's important to me, too, to have these questions answered so I can provide the very best care for my patients as well. Thank you again, Meghan. Everyone, have a great day. See you soon. Bye-bye.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Vazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.